This morning on today's Health, understanding strokes. They are the third leading cause of death for women, but often women are unaware of the telltale signs or how to prevent one. Dr. Keri Peterson is an internist and contributor to Women's Health magazine. Dr. Peterson, good morning. It's good to see you. Well, let's lay it out here. First of all, what a stroke is and how common they are with women.
Sure. Well, first, a stroke is when the blood supply to your brain is compromised. And when that little piece of brain is not getting oxygen or nutrients, it starts to die. And there's really two different types of strokes that can do this. The first is called an ischemic stroke, and that's the most common one. About 90% of strokes are ischemic. This is when the blood vessel is obstructed or blocked from either a clot or atherosclerosis. And that's in contrast to what's called a hemorrhagic stroke. That's also known as a brain bleed, and that's when the blood vessel bursts or leaks, and then again the tissue starts to die.
And then there are TIAs, which is what, like a mini stroke?
That's like a mini stroke.
Yeah,
that's a temporary disruption of the blood supply, so the symptoms usually resolve on their own.
Okay, are men and women equally at risk of getting a stroke?
Well, the statistics for strokes for women are actually quite distressing, Savannah. First off, women die twice as often from strokes than they do from breast cancer. As you may have mentioned, it's the third leading cause of death after heart disease and cancer, and women get more strokes than men. And the simple reason is that strokes increase as you age, and women outlive men, so they have more strokes, and they get more disability from strokes.
Let's talk about risk factors. I know some men and women have in common, and some risk factors are specific to women. Can you lay it out for us?
Sure. Okay, so the ones that they have in common are very similar to heart disease: family history, high blood pressure, high cholesterol, smoking, diabetes, being overweight, and lack of exercise. But women have additional risk factors that are specific to them. And the first is that if you have a thick waist greater than 32 inches, your likelihood of stroke goes up 6 times.
Wow.
Another is high triglycerides. That's a contributing factor. Migraines. Women who have migraines are 3 to 6 times more likely to have a stroke than women who don't.
Is there a particular age where women are more at risk for a stroke?
It's really as you age.
Yeah.
So once you hit age 55, every decade after that, your risk doubles.
Let's do symptoms. Some symptoms men and women have equally, and some symptoms are specific to women.
That's correct. So symptoms that both men and women will have, you may be familiar with: weakness or numbness on one side of the body, confusion, trouble with speech or sight, trouble walking, and severe headache. But women may get additional symptoms that they may not identify as being a stroke. For example, hiccups. Kind of a surprising one. That's an unusual one. Nausea, chest pain, shortness of breath, and palpitations are all unique symptoms to women for strokes.
But you would expect to have some of these symptoms in conjunction with other symptoms.
Yes, you may have a combination, correct.
Okay. Now, talking about preventing a stroke, I mean, what are your best preventative tips?
Prevention is very similar to your prevention for heart disease. So you want to reduce your blood pressure, reduce your cholesterol, don't smoke, control your diabetes, maintain your weight, exercise regularly, and drink in moderation if at all.
If you've had a stroke, I know sometimes doctors prescribe a medication to prevent another one. Or do they ever give this medication prophylactically if they think you're at risk for a stroke?
That's true. They do. It's called primary prevention, and what your doctor will do is assess your risk factors, and if you fall into a high risk category, you will be placed on an antiplatelet agent which thins the blood.
Okay, so bottom line, if you're, I mean, at what age do you have to start really paying attention to this? I mean,
you should start initiating lifestyle factors that we discussed in your 20s and in your 30s.
Yeah, okay. Dr. Keri Peterson, it's good information. Thank you so much.
Thank you.